Good morning and welcome to the 9:30 call. I'm coming to you live from New Orleans, where the NAYC Professional Learning Institute is happening. There's a strong Massachusetts representation here. It started on Sunday. It goes through Wednesday. I'll be on the closing panel on Wednesday. And so it's great to be back at NAYC, seeing folks from across the country. Okay, so let's see. Great. So thanks so much for joining us, Jack. It's so great to have you here. Our first question that we ask everybody who joins the 9:30 call is to tell us a little bit about you and how you came to be in your current role. And while we probably can't hear your full history, give us as many details as possible. It's always a great question to hear the answer to.
So great, Amy, thanks again. And hi, everybody. I see some familiar faces on the screen. So I'm going to be very short. I don't want to take up a half an hour talking about myself. I really want to have a conversation. So I'll start by telling you that I'm about to start the sixth chapter of my career. Okay, so I'll name the first five, and then let's have a conversation. Okay. So the first was my early training. I was trained as a pediatrician. I went to medical school. I did a residency in pediatrics and started out basically working in a community health center in the South Bronx in New York and expected to spend my life doing that. But I realized I needed a little bit more training in child development, if that makes any sense. And I'm also particularly interested in learning more about developmental disabilities and complex health problems, how they affected children's health and how families manage those issues. So I moved up to Boston and did a fellowship at Children's Hospital, and where I kind of learned a lot about disabilities, and I learned a lot about development behavior writ large. And then I got seduced into academia. I mean, that's a longer story, but I was at Children's Hospital for a couple of years and then went out to the University of Massachusetts Medical School, which at that time was a relatively new medical school with a focus on primary care. And I was chief of the Division of Developmental Behavioral Pediatrics there for, oh my God, 15 years. And really thought I would be in that space for my career. Had what my wife called an early midlife angst. It wasn't exactly a midlife crisis, but decided that the healthcare system was too resistant to change for the kinds of things I wanted to do. So I made this weird shift. I went from there to become dean of the Heller School at Brandeis University. It's a graduate school of social policy and management. That's obviously a long story about how that shift was made, but no time to talk about that now. And I was the dean there for 11 years with three consecutive kind of 5-year commitments. And at the end of the fourth year, I said, sure, let's do another 5 years. In the late 90s, I had this career-changing opportunity to chair the Board on Children, Youth, and Families at the Institute of Medicine, National Academy of Sciences, and chaired a study committee that was my dream project that produced a report called From Neurons to Neighborhoods, the Science of Early Childhood Development. The concept was that the early childhood field was so kind of disjointed. You had childcare, you had early intervention programs, you had primary health care, you had preschool, home visiting, and having kind of been involved in all of them, it was really clear to me that there was really just one underlying science, even though all of them had their own science, their own ways of being trained. And so I had a dream team that worked with for 3 years, and we produced a report that really changed my life because it just got me focused on the untapped power of credible, trusted science to kind of affect the field. And so in my 11th year, as my 11th year began as dean of the Heller School, I gave a year's notice and said, that's enough time to be the dean here, and I really want to go back and devote all my time to early childhood. I wasn't quite sure what I would do next, and in the spirit of amazing opportunities that come along that you're not expecting, I was approached first by Julius Richmond, who many of you may know, who was the founding director of Head Start when he was at that time in his late 80s, and was an emeritus professor at Harvard, about whether I might want to come to Harvard to create a university-wide center on children. And it was like, And then Steve Hyman was the provost at that time, and he had been head of NIMH and was a major funder of the Neurons to Neighbors report. And so um, that's another long story. What I'll say, it was really scary and risky. I kind of thought there was a good likelihood I would get eaten alive and have nobody would respect me at Harvard. And it would be like, oh God, what a mistake. But I figured I could always have a plan B. So I gave it a shot and was given the opportunity to kind of define the mission of the center. The university wanted a center that crossed the schools, and so I had a faculty appointment, the School of Public Health, the School of Education, and the medical school, and basically took the Neurons to Neighborhoods lesson and said I wanted to create a center that would be a trusted source of credible, hard, complex science and make it actionable and make it accessible and understandable and actionable for the early childhood field, which is also going back to my pediatric roots. You can't be a pediatrician if you can't explain complicated issues in a way that parents can understand of things that are happening with their children. So that was 18 years. My God, that was 18
Wow.
years ago that the center was created. And in the last 2 years, um, the senior leadership team and I started to talk about two things. One is I really wanted to dig deep in and spend all my time working on kind of moving the early childhood field to another place. And also a healthy organization doesn't wait until somebody gives a couple of months' notice to retire. And I had no interest of retiring at this point.
Right,
So we started succession planning. Um, and basically have lived into that for the last year. I have really spent much less time running the center, and nobody notices that on the outside because it's an amazing leadership team. And
right,
so I'm now, effective July 1st, going to officially change from being director of the center to founding director of the center with my own independent portfolio of work, which I'd love to talk about,
sure,
to kind of be my next chapter of because there's a lot of unfinished work in the field. So let me kind of stop there, Amy, because
sure.
already it's taking too much time to talk about my pathway, and let's open it up to anything you want to talk about.
Well, I think I also wanted to set the record straight because I know in the communications it was very clear that you are not retiring. So I wanted to make sure everybody heard that loud and clear here on the 9:30 call and spread the word. And I think and folks keep adding questions to the chat. Kim Davenport added, so glad you took that risk that LEAF has transformed the field of early education. Rosie Batista says, love seeing you, Jack. Danubia says hello, Harvard 17. So I think as you think about, that incredible pathway, and this is our favorite question on the call, because for most people, it's not a straight line for how they ended up where they are. And so all of that you learned there, tell us how that's connected to what you're thinking about doing next.
Yeah, so I'm going to take another risk. I don't want to be misunderstood. So I have spent my entire career focused on and caring about early childhood, and I am deeply invested and committed in this field to this field and to all the people who are working in it. Um, and I'll put myself at the top of the list now and say that those of us who are concerned about early childhood should be really proud of where this field is and how far it's come, and should be lovingly, constructively dissatisfied with how much of an impact that we're making. And so I'm kind of taking a risk and wanting to get out there and say that this field is strong. This field has a strong knowledge base. I'm kind of I'm realizing how much my early pediatric training influenced the way I behave about things. When you're a doctor, you got a strong science base. You also have a very strong field that doesn't worry about having its funding renewed year after year. That's one major
That's
difference.
right.
But that you know where you can make a difference with the kinds of concerns and problems that come up. You know where you can't make things, you can't completely eliminate the problem, but you
Right.
work really hard to improve just function and health and development and everything else. But there are also things that you feel you're not making an impact on at all. And you're depending upon the research part of the field to come up with new ideas and new strategies. And so you're not defensive about what you don't know. And you're saying, we use what we know, we make a big difference. Millions of kids are better off for what we do. But you don't kind of hide the fact that there are some areas where you're not making enough progress, and you want to put a bright light on that. And we don't do that in the early childhood field because we're adaptive biology. We adapt to our environment. So adapting to the environment is to basically emphasize the fact that we know what we're doing and all we really need is more money. And that's smart. That's how you stay in business. I hope I can't see. I hope the wrong people aren't on this screen. But
No,
I think I really think that this field is too strong to say we know exactly what to do all the time and all we need is more
yeah,
money. We should be saying that we need new ideas. We need the space to try things. New interventions don't work the first time you try them. And so I want to, we have this, I don't know how many of you know about it. You'll hear about it more as the next couple of years. The science that the field has been sitting on, neurons to neighborhoods was part of it, but not the only thing. It focused on brain development, focused on the importance of serve and return interactions and relationships, and a focus on how toxic stress kind of disrupts developing brain
right,
circuits with consequences. That's now a 25-year-old science. A
right,
lot has happened since then. So I'm now devoting my next chapter to trying to leverage what we're now calling ECD 2.0, which is number one, connecting the brain to the rest of the body. Everything we've said about the brain applies to other biological systems. It's as much about lifelong health as it is about early learning and school readiness. Number two is relationships are critically important. They're the final pathway into children's development, but place matters. And it's not just about relationships. And we have to really, Ewing Bronfenbrenner told us about that 50 years ago. And
right,
still, we say the answer to everything is relationships. I can't for the life of me figure out how relationships can overcome structural inequities like racism and intergenerational poverty. That's not going to answer those problems. So I'm focusing much more on the missing piece of early childhood policy and programs, which is community-led, on the ground activity in communities. And then the third piece, which I have now come to be convinced, is why our evidence-based programs continue to show relatively modest impacts on average, because we define evidence-based as a statistically significant mean effect between a treatment group and a control group. And we get these relatively small effects. And it's because, and people say, I don't understand this. We see big effects all the time. We do. We do. We make big effects on some kids and families, smaller effects on others, and no effects on some, not because the programs are no good, but because this is another big scientific concept that has to be out there. Differential sensitivity to the environment, right? It starts with a common sense thing. Every family that has more than one child, same biological parents living in the same household, will tell you that they're not the same and
right,
that there's differences. Who's the most sensitive in the family? Who's the one who seems to roll, right? So nobody would say that the average child in a family represents the reality of different kinds of kids. So why are we just looking at average program effect and not recognize that some kids are more sensitive to adversity than others? Some are more sensitive to protection, and all respond differently to interventions and policies.
right.
So in order to, I learned this, it's a longer story, there's no time for this. Let me just say that what I've learned from people, and it's actually back in people in medicine, who say, this is particularly people who treat cancer in children, particularly leukemia, which is the most common form of cancer in children. They went from a 5% survival rate in 5 years to a 60% survival rate in a 10-year period by recognizing that whatever the best treatment was didn't work the same for everybody. So the issue here is their mantra is take the best of the knowledge you have, apply it, and expect variation in response and be prepared to be flexible in how you're implementing the treatment and figure out how you have to modify it based on different responses. And oh God, one more thing, and I'm talking too much. One more
You're not,
thing. I
we want
went
to hear
back
from you, Jack. The chat's showing that we want to hear from you. And so keep talking.
I went back to Perry Preschool in Abecedarian, right?
Wow.
How much more? There's no more blood to squeeze out of Perry Preschool, no
Right.
more. And if you ask policymakers and tell them, how could we tell policymakers right now that for every dollar they invest, they're going to get whatever it is, $9, $10, $12 back, which is based on just Perry Preschool data
Right.
and nothing else. And nothing that we do now has the magnitude of impact for Perry Preschool. Why is that? Okay. So here are some suggested ideas, because I went back and looked at what we know about Perry Preschool. First off, it was 50 kids in the program compared to 50 kids, very small. The staff in Perry Preschool were all certified in elementary education, special education, and early childhood education. It was an incredibly highly skilled staff, and they were paid enough to want to stay in that job, and they got bonuses for coming out of the job. So one thing is you have to have staff with the capacity to deliver what Perry Preschool. And let's not talk about cost if the issue is return on investment. I'm not naive. It's not like people will pay. But that's one thing. But here's the bigger thing that I did not know until recently. The Perry Preschool teachers met weekly and discussed with each other how they were adapting that very highly structured curriculum based on how kids were responding differently to it. Holy mackerel. That is so amazing. They didn't take an intervention and said everybody gets it the same way. They had the skills and the freedom and flexibility to figure out how to adapt it and modify it, and got these ridiculously high results relative to what we get today. We say, how little can we pay people to work in these programs?
Right.
How can we give them a protocol and say follow it, and not ask them to or expect them to do maybe what is the sweet sauce of Perry, which is that it was adapted and people expected nobody to respond the same. So heterogeneity, variation, and sensitivity. You can't have 50 different policies and 75 programs.
Right.
You have policies and programs that work for most kids and families, and then you staff them with people who have the capacity to tailor it and modify it based on which is what every good service provider does. I'm going to shut up. There's so much I have to say about what I want to do next. Each of my chapters has been the best one I've ever had relative to the ones that came before. And I'm hoping to be a friendly, constructive pain in the ass to the early childhood field to say, stop saying we know exactly what to do. All we need is money. That is a defeatist. That's a bad strategy. It's a really bad strategy. But we can't unilaterally disarm. So we've got, have people who will provide the support. But the thing I want to focus on is let's not have everything depend upon direct services for children and families. We have got to bring early childhood into the place-based world, and they've got to come into the early childhood world. The future, in my mind, of early childhood policy and programs and place-based, promised neighborhoods, purpose-built communities, all of these community-based, they want a stronger early childhood dimension. We need a stronger community dimension. The future of both these fields has to come together. So I'm sorry, I took up too much time.
No,
Questions, please.
so I'll go through the
Questions,
chat.
Michelle.
So Tom Weber shared one of the most thoughtfully and powerfully constructed 6 words that I've ever heard. We should be lovingly, constructively dissatisfied with the state of support for ECD. That got a lot of support. Donna Danette shared, this is so deeply impactful.
Can I just say, and be proud of that, not be defensive about it. Be proud.
Yes. Somebody said they could listen to, Roxanne said she could listen to you all day. Lots of hearts saved. It's almost mesmerizing to see all the nodding heads, goosebumps. So interested. You make me think we've known for years as EC people, we individualize curriculum all the time, but we haven't applied that concept to the systems and the approach changes. Rosie also added, I also appreciate how you told my ed class not to classify all the research as deterministic to give families and global south hope. Love to hear what you're saying. Are you going to do a podcast in your next chapter? Long live the agitators. Childcare, equals community development. How can we collaborate more strategically with the health field directly, especially with the high need of childcare and healthcare professionals? And then tailoring and modifying systems is something that educators need licensing agencies and policy setters to do as well. We are superb at modifying and accommodating for every individual child. Could the systems modify and accommodate the diverse and unique early childhood settings and programs, please? But also, can we have the flexibility? Jack, this call was created in March of 2020, because of the pandemic, to provide a place for us to come together and be innovative and be creative, which was driven by fear and anxiety, but also the passion that people who opened up emergency programs, not knowing how this health pandemic was spread. We saw that the most incredible things happen on this call and in the field, but just really thinking about the spirit of innovation, which often gets overlooked and kind of undermined in early childhood. So maybe talk a little bit about the question around the health, like how do we better connect it? Because I think this is a place where there's been a lot of different efforts, but it's been very surface. So maybe say a little bit about the community, the health, and the early ed space, and what your vision is for the future.
Yeah, oh God. Invite me back sometime to spend
In
more
eight
time to
minutes. Well, I was going to say,
talk
Jack,
about.
maybe we have a once a
So,
month fireside chat
so
with you.
for starters, so many things to learn from the pandemic. Um,
Yeah,
and in terms of our work, I mean, the pandemic decimated a lot of the early childhood infrastructure, right?
right.
And I think everybody knows that now is an opportunity to not just rebuild what we had before, but think about how to build a different kind of
That's
system.
right.
For me, the big lessons from among the big lessons from the pandemic were um, the fact that no matter how staggeringly um, potentially powerful the science is, it's going nowhere if it doesn't align with people's lived experience. I mean, I have people, normally it takes 15 to 20 years to develop a vaccine. How the hell was a
Right.
vaccine developed in 1 year? Because the underlying biology of messenger RNA was for 20 years was being developed, and it was there to be used because money got put into it. But not everybody bet I mean, laid bare inequality, the combination of the pandemic and the televised murder of George Floyd just kind of really had to be the most unbelievable wake-up call to all of us, and especially the early childhood community, for number one, just telling people about the science isn't good enough. It has to relate to what people will trust, what they will believe, and it has to relate to the most unbelievably oppressive, politically contentious environment in all of our lifetimes, including uh, I might be the oldest person on the screen. Okay, so it's not enough to just say we have science. Science says this. We have to relate, and not just the lived experience of families with young children, but the lived experiences of people providing services, the lived
Right.
experience of people running systems, and the lived experiences of policymakers. I will tell you, my focus for my next chapter is conservative states. I'm not interested in spending a lot of time preaching to the converted. And my interest is, well, I don't want to get too political on this thing right now. There are parts of the political spectrum that I don't really kind of want to spend a lot of time hoping to convince, but there are large parts of the political spectrum that is not automatically friendly to early childhood, but needs to kind of do that. So I think the science isn't enough, our experience isn't enough. Any data that we put out there, it's immediately challenged by people who have an alternative interpretation.
Right.
Um, and I think that we need to kind of find places. Your point about communities, Amy, the other thing that is guiding me right now is I'm going to be working in places that are asking me to bring in what I have to bring to the table. And I'm asking them authentically to be used. I want to be used by people who want to change what they're doing. I don't have a program that I want to sell to people. I'm not saying I've got an answer who wants to work on this. I want people who think I can add value to what they're doing. By I mean, the science, not just translated. That's the other thing. For a long time, our center was in the business of making science accessible.
Right.
And I think that's step one, but that's not remotely enough. We have to make the science actionable. People have to say, oh, not just, oh, I understand it, but that's making me rethink what we're doing and it's all about the holy grail for me now is increasing impacts, dramatically increasing impacts. And part of that means that finding out where are we making a big impact and doubling down on that part of the population, where you're making a smaller impact, and figure out what to do differently. And also the variation issue, there are two dimensions we have. Please go on our website. We don't get paid for this. Our latest working paper, which came out last month, it's called A World of Differences. It's about heterogeneity. It's about the hard science that also everybody knows and has been part of developmental science for decades, is that the average isn't telling you what the reality is. It's variation. And in our field, there are two kinds of variation. There's variation by demographics. There's variation by race and ethnicity and income and parent education. That's group variation. And the biology is very clear. There's no biological basis for race or ethnicity. It's racism, it's not race. And those are real. And that kind of variation we need to look at. But there's also within group variation, which is the one that we've got. That's what the Perry preschool people did.
Right.
It's like within any group, there's variation. So, and at the program level, at the policy level, resources have to go to communities and parts of the population that have greater need. But at the individual level, it's individual variation. So this is my last thing before we close down. Social determinants of health and ACEs, okay? Social determinants of health is not a new concept.
Right.
I learned about that when I was in medical school a long time ago, right? Social determinants of health help us decide which parts of the population kind of have unequal access to opportunities. But social determinants of health are not the decision you make about individuals. You don't say a kid is poor, a family has low education. You can't predict that child's future by social determinants of health. So we have to look at individual response to social determinants. And I'll end with the hot potato. Please, ACE scores, right? ACE scores are very helpful on a population level. They tell us how the more risk you have in these early traumas, the more likely you'll have heart disease and hypertension and diabetes. But this has been studied. There are several papers that have been published, peer-reviewed journals, to say it's a good population level predictor. But on an individual basis, if you do an ACE score on a child, the chances of that predicting future health for that one child is no more than the flip of a coin. It's not an individual measure. Oh my God, I mean, we've got to do something about not throwing out ACE scores, but you have to combine it with then looking at, so is this child with this level of adversity, is this child in trouble? As opposed to this child and this family are actually doing remarkably well. I'm sorry. I know you probably have a
No,
hard.
please stop apologizing. So I just want to, we got a minute left, which is a lifetime here on the 9:30 call. Kim Davenport adds, there's such a high degree of expectation that early ed delivers big and over and over and over. No other field demands such absolutes, and it uses an all or fail mentality. And I also just want to personally say, Jack, so as a former educator, now advocate, right? Having you in Massachusetts has been an incredible resource. But just, I think part of the 9:30 call has been about bringing people who kind of have your profile to the 9:30 call to sit on the Zoom screen besides family child care providers, educators, directors, family advocates. So we would love to have you back. And now I have your scheduler's email, so you're in trouble. But just to have these half-hour conversations, because there's a ton of gratefulness and appreciation in the chat for kind of starting the day like this. We often say that we get the inspiration that we didn't know that we needed on the 9:30 call, and you certainly have delivered that today. I want to personally appreciate all the work and the foundation and making the science accessible, not just to families, but to practitioners, and what a change that has made for our field. And along with folks in the chat who are sharing a lot of excitement, am just so excited to think about what this next chapter looks like. I think it's so timely, and I know you want to, concentrate in other states, but right now our governor has a task force with economic development, education, and labor and workforce working together. So it'd be great for you to share some of your thoughts with them.
Can I get a final
I'll
word
give
in
you the
on that?
last word, Jack.
Three things. One, to your last point. I hope this doesn't come out in the wrong way. It's not that I'm looking to be pandered to, but at this stage of the game, I want to work with people who are dealing with challenges and think I could add value.
Yes,
And I
appreciate it.
want to figure out how to do that. I don't want to convince people that they should listen to what I have to say.
Right.
The second thing is two themes that didn't get touched on this one. They're really important. We need to pay much more attention now. We need to dig in deeper into the prenatal period and the first 2 to 3 years after birth. Okay. And not leave everything to starting at age 3 and 4. And related to that is everything that we do now to improve school readiness and enhance early learning. By doing nothing else but just what we do right now, we are decreasing the risks for physical and mental health problems later in life. So we should stop just thinking about the return on investment in third grade reading scores and high school graduation, and think about the return on investment in down the road. Unfortunately, after all these people who are in positions right now are going to be out of office. So it's a legacy issue. It's not a reelection issue, but that it's going to be, we're going to have less heart disease, less hypertension, less diabetes, and the list goes on, because we're protecting other biological systems, not just the brain, when they're developing. So there's just a lot that untapped potential in the field for bringing together tremendous science and lived experience.
Well, we also want to be a resource and a place where you can come and try out some ideas and think about ways. And I, because I think how all this information gets out there is so incredibly important. So much appreciation for everything that you're doing in chat. I will send it to you. I will also, you're always welcome to come back. Maybe we can have a summer check-in where you come back and tell us about kind of give us an update. But please keep us in mind as to think about a place we would love to have you come back, and just thank you so much. I think for me, hearing about the Perry preschool aha was so significant because I
Well,
think it's incredibly important.
so I see a lot of people I know on the screen, and I apologize. I can't do two things at once, so I'm not sending you direct chats to say hello, but hi, I see you. You know who
That
you
was
are. I see you.
we had almost 100 people on the call this morning. We are recording it, so if you are watching this recording, please continue to check in. And Jack, we look forward to staying in touch. And just thank you so much for joining us this morning.
Thank you, Amy. Really appreciate
Okay,
it.
have a
Take
great
care.
day. We will see everyone tomorrow morning on the 9:30 call. Take care.